Hello everyone and welcome to Shantilal Sanghvi Eye Institute's Netrape Charcha. I'm Malvika Goradia and today we are here to discuss a very important topic, glaucoma. Glaucoma is often referred to as the silent thief of sight, and this is because in a lot of cases people don't even realize it until it's very late. In India, over 12 million people have glaucoma. However, sadly 90% of cases go undiagnosed. Today we have with us two amazing ophthalmologists, Dr. Nandini Banad
Namaste.
and Dr. Harsha Abhishek.
Hello.
They are going to answer some common questions about glaucoma. So let's get started. So Dr. Nandini, can you tell us what is glaucoma?
Glaucoma is a group of eye diseases which happens because of raised in the intraocular pressure in the eye, causing damage to the optic nerve head, in term which is called as glaucoma.
Okay, and why is it important to raise awareness about it?
It's a very important question. Glaucoma, the first important point to be remembered is it is the second cause of blindness worldwide, next to cataract. And as you rightly mentioned, it is also called a silent thief of vision, because unless 60% of the vision is lost, people usually do not know that they have glaucoma. As you rightly said, it goes undiagnosed in most of the cases. And once the vision is lost in glaucoma, it is irreversible damage to the vision. So this makes the disease very rampant, and it is very essential to treat it in early stages. So all these factors make glaucoma a very important disease to be diagnosed early and treated appropriately.
So that's so important because that only means that we need to screen more often, right?
Yes, correct.
So Dr. Harsh, can you tell us what are some symptoms of glaucoma?
Yeah, the symptoms of there can be various types of symptoms for glaucoma. It can be diminution of vision. Patient can also have redness in the eye, or can have pain in the eye. Various subtypes of glaucoma patient can also present in acute cases with headache, nausea, vomiting, colored halos. But what is most important in glaucoma is that glaucoma can be totally asymptomatic. So when I say asymptomatic, that means that in initial stages, patient will not have any symptoms. So it's very important to note this fact that this is one of the main reason, as you were mentioning, that it goes undiagnosed. So the nature of being remaining asymptomatic in glaucoma is something which is very important to be taken care of.
So that really means that a patient might feel nothing and significant damage is already done. That is pretty scary. So definitely early detection is key, right?
Yes, early detection by screening is very important. And as I mentioned, only in the later stages, patient will have the peripheral loss of vision, and the central vision in glaucoma remains almost till the end of the disease. So patient remains vision-wise asymptomatic, till most of the optic nerve is damaged.
While that's scary, it also gives us some reason to screen more often.
Yes. So screening is very important, especially in patients who are more than the age of 40 years. We always advise the patients to get their eyes screened after the age of 40 years.
Dr. Nandini, how do you diagnose glaucoma, and is there a way to prevent it?
Yeah, first to how to diagnose glaucoma. Basically, there is no extra added any investigations or something where we can pick up glaucoma. But the only thing which I would suggest is to undergo a routine eye examination, maybe after 40 to 45 years of age. Annual eye checkup is what is recommended. So how a doctor diagnoses glaucoma is something like where we do routine examination. In that, there is few tests which we do, which includes intraocular pressure measurement, and also assess the optic nerve head, which gives us a hint if there is glaucoma or not. Depending on whether there is glaucoma or not, we do some investigations. In that, the most important one we called as visual field testing. So by these modalities, we can pick up glaucoma in the early stages also.
But that being said, it is important and non-negotiable to have those early checkups.
Yes, so annual checkup after 40 is highly recommendable, because as already mentioned many times, early detection of glaucoma and treatment helps in preserving the vision. So that is what is very mandatory. So there is no other test, or as already mentioned by Dr. Harsh, it is asymptomatic in the early stages. So It is not like a patient will have some symptoms where they can consult a doctor and say or suspect glaucoma, which is most common in cataract. So when in cataract there is loss of vision, because of which a patient usually consults a doctor, but it doesn't happen with glaucoma.
Fair. And is there any way to prevent glaucoma?
So always we cannot prevent glaucoma, but to an extent I can say that we can reduce the consequence or the impact of the disease to the patient and his lifestyle. So what we can do to prevent glaucoma is, again I'm emphasizing, is annual checkup is the number one thing which we would suggest to do. Other than that, in a patient who has a history of trauma in the past, or if a patient is a diagnosed case of diabetes or hypertension, so such patients to be under regular checkup is good. Other than that, annual checkup.
So once detected, are there any treatment options available for glaucoma?
Yes. So there are various treatment modalities available for glaucoma. So as we know, intraocular pressure is the main modifiable risk factor. So our first aim in glaucoma is to prevent the raise of intraocular pressure. How we can do this is by various means. So first is the medical line of management, where we start topical anti-glaucoma medications for the patient, and these medications have a selective dosage for all the different types of medication. And once the pressure is under control with medication, then it's fine. We advise the patient to comply with our topical medications, what we have advised, and continue the same lifelong. Apart from that, apart from the medical management, there are various type of lasers which can also be done in glaucoma. So these are various types of lasers which are used in various subtypes of glaucoma. Like how we have YAG peripheral iridotomy, which is done in certain types of glaucoma. And also we have selective laser trabeculoplasty, which can also control intraocular pressure to a certain extent.
What about surgeries? Are there any surgical interventions that can be done for glaucoma?
Yes, there are surgical modifications which can be done to control the intraocular pressure to prevent the further progression of glaucoma. So when the topical anti-glaucoma medications are not able to control the intraocular pressure, and when even in spite of using the drops the disease is progressing, so that is the time when we look towards surgery, and we can say that surgery is kind of final frontier to control the progression of the disease.
Okay.
There are various surgical options available, right from the age-old technique of trabeculectomy, which is still practiced, to angle-based surgery, which are the recent advances, which all aim to reduce the intraocular pressure. So the choice of surgery, topical medication or lasers totally depends upon the type of glaucoma the patient is having and how fast or how slow the progression is. Depending upon that, we can decide to start with what treatment modalities we want to go ahead with.
So that's really reassuring. So even though glaucoma cannot be cured, it can definitely be managed with the right treatment.
Yes.
Dr. Nandini, can you tell us how glaucoma can affect our day-to-day activities?
Glaucoma in the initial stages, as we already discussed, does not affect most of our daily activities. But as the disease progresses, where the patient visual field starts to get affected, that is the time when it can have its role on a patient's routine activity. So usually patients tend to have a problem with the mobility. They can have mobility restrictions. They start to bump and trip onto the objects, and it can also have social impact, as in there can be dependent. They start becoming dependent on other individuals because of their field is reduced. And also for the installation of drops, at times it becomes difficult for a patient to manage by himself. And also there is some emotional turmoil on the patient because he's been diagnosed with an irreversible loss of vision the disease causes. And also the financial stress to the patient is also there, because despite the medical management or the surgical treatment, it is a lifetime diagnosis. So it's a lifetime disease. It cannot be cured, though it can be kept under control. So all of these things can have impact on a patient's life, and definitely their quality of life is hampered.
And are there any lifestyle changes that can help manage it?
So other than following your doctor's advice and going for a proper follow-up, keeping the intraocular pressure checked regularly, Other than these important things, I think the minor things which a patient can give attention is to not to have any bad habits like smoking and alcohol consumption, that one a patient can take care of. Other than that, some of the yogasans, say where there is breath holding episodes, say, and Shirshasana, it is better that a diagnosed glaucoma patient avoids it. And also there is this tendency, like few people tend to consume a large quantity of water in the morning, say maybe around 1-2 liters they have in one go, so which is a strict no for glaucoma. So these are the things which we advise in the last, but initially it is the intraocular pressure, the modifiable risk factor, which we need to take care of.
So that really makes so much sense, that small changes like avoiding having water in the morning can make such a big difference in protecting vision for those who are diagnosed with glaucoma.
Yes, you're very right, Malvika.
I totally agree what Dr. Nandini has said, the points about maintaining the lifestyle, and also it is very important to have a balanced diet, so that can also help to control in all the general health of the patient. And one very important aspect of glaucoma is diabetes and hypertension. Okay. So controlling diabetes and hypertension also tends to slow the progression of the disease. So any diabetic or hypertensive patient should also take care of their sugars and blood pressure in order to control the glaucoma.
Thanks for adding that. That's very interesting. So how can individuals participate in spreading awareness regarding glaucoma?
Yes, so Glaucoma Awareness Week is celebrated across the world in second week of March every year. This is celebrated in order to spread the awareness about glaucoma. So as you had mentioned, that glaucoma is one of the leading cause of irreversible blindness in the world, and also almost 90% of the case remains undiagnosed. So for this, it is very important to do the screening for glaucoma, because in screening only we can detect the disease in an early stage, and detecting the disease in an early stage is very helpful to prevent the progression of the disease. So in glaucoma awareness, a patient can always ask his colleagues or peers to get their eyes checked after the age of 40 years. Also, what is very important is any person having glaucoma in their family screening is very important, because glaucoma can run in families. If the parents are having glaucoma, their children are very prone to have glaucoma. So screening for glaucoma, especially family screening, if there is any individual in your family with glaucoma, is very important. And apart from screening, as I had already mentioned before also, after the age of 40 years, it is very important even for a normal individual to get their eyes a complete comprehensive evaluation done in order to detect any undiagnosed glaucoma.
So that's quite insightful, that genetics also play a role in glaucoma, and that it is important for an entire family to get screened in case any individual of the family has glaucoma. So as we come to an end, is there anything you would like to add?
Yeah, so a few things which I would like to highlight is glaucoma, though it is seen in elderly age group, it can affect at any age. So even a child can be born with glaucoma. So it is not like elderly age group is the only affected group. Okay. So the second important message I would like to give is a routine annual checkup, say after 40 years of age, is very mandatory to pick up glaucoma in early stages.
So as Dr. Nandini correctly said, though glaucoma is an irreversible loss of vision, however, once diagnosed and the patient is on certain medications, it is very important to stick to regime and prevent any vision-threatening consequences caused by glaucoma.
So today we thank Dr. Nandini and Dr. Harsh for their valuable insights, and I hope that our viewers have gotten a better understanding of what glaucoma is. And the biggest takeaway, don't wait for any symptoms, get your